I don't think anybody realized the severity of the injury right away. There was actually nothing to the eye that would draw you to the severity of what actually happened.
When we took the wrap off, there was just a very, very small nick right above the fetlock.
I'm Kelli Cruciotti Vanderveen. I am the resident Grand Prix show jumping rider here at Serenity Farm Show Stables.
Cindy Cruciotti, and I'm the owner and head trainer of Serenity Farm Show Stables.
My name is Axel Beccar Varela. I'm a veterinarian and owner at Paddock Equine Veterinary Services in Wellington, Florida.
We were at the Live Oak International Horse Show. It was the first day of competition. I believe it was the meter 45 power and speed, first class of the week. I was feeling excited. Mo was feeling really great in the warm-up. He jumped the first half of the course really beautifully. We started in the speed phase, and I remember going from the second to the last fence to the last fence. I remember seeing out of the corner of my eye him throw a shoe, which isn't uncommon. It's just grass, it's very soft. I figured no harm in continuing to finish the last jump. And when I landed off the last jump, I knew that something was not right.
We had been using the hardback boots on him and they'd been rubbing him. So we decided to put polo wraps on him. And I saw the shoe fall off. And as he jumped in, the shoe kind of flew up and you saw the shoe fly away. And I thought, So Kelli walked out, we went straight to the farrier. He was a bit lame, put the shoe back on, and still not 100% sound.
You hope that it's a foot, they bruise their heel. A lot of times horses can reach up and just zing themselves a little bit and give them half an hour and they're completely fine.
We took him back to the stables, and when we took the wrap off, there was just a very, very small nick right above the fetlock. Not even a quarter of an inch long and probably less than a 1/16 of an inch deep. We washed it, we cleaned it up. He's still quite lame. We called our vet and had her come out. She did a once over. She said probably just an issue with the shoe. So we started him on some bute, took him out, withdrew him from FEI. That evening I got a call from one of my grooms who said that he was non-weight bearing.
When you're on the road, you're not dealing with vets that are your normal veterinarians, so it's also difficult for them. They don't know the horse. They were hoping, as we were, it was a foot bruise, or when he pulled the shoe off, he maybe reached up and grabbed his heel.
Right above the small cut, the neck, there was a patch of kind of silky fluid. Wasn't on top of the cut, so the cut wasn't excreting anything. I called our vet and I said, I have a suspicion that this is joint fluid. And she said that cut is so small, it's highly unlikely. So we went on treating it that he had just traumatized the foot by pulling the shoe. We continued to treat the cut. The leg did get quite a bit swollen. This was on a Friday that it happened. By Saturday evening, he was very uncomfortable, even on the bute. So we brought him home for our vet, Dr. Axel, to see.
When we got home, immediately our home veterinarian, Dr. Axel Beccar Varela, he right away picked up on the severity of what the injury was.
When I was called to evaluate Mo after the accident, my concerns in the initial exam were that there was severe tendon injury with trauma to the tendon sheath, and there was an established infection already in the area.
After an ultrasound and a blood test that indicated the horse Mo had a massive infection, he was right away shipped to Palm Beach Equine, where they performed a surgery to clean the tendon, to try to get the infection under control, because that was the biggest issue at that moment was the severity of the infection.
The prognosis was certainly very poor when you look at the degree of inflammation and the injury that we had.
They came out of the surgery saying they did the best they could. The severity of the injury was significant, and they gave him about a 20% chance to ever recover.
There wasn't a whole lot of optimism. The lack of optimism also reflected not having a lot of past injuries to compare to. There wasn't a whole lot of information to go off of, case studies or different horses that had come back from this specific injury. There weren't a lot of those. We were kind of just hoping and praying.
There was about 30% or more of the tendon that was severed, but we decided to go forward with treating it. First 2 months we were having a typical response for a severe tendon injury where we actually saw some initial worsening on the injury and like concerns, and of course like the concerns for his recovery were real. But then about 2 months into the treatment, we started seeing a big change in his ultrasound images.
We started to see the tendon area itself from where the impact was and where he had severed the tendon fill in with a very small amount of scar tissue. So each month, probably 6, 7, 8 months in, we started to have a little bit of hope that he could fully recover.
CRF in the past, I can't remember if in this case she brought it up or I brought it up, is definitely always part of my recommendation for some of these horses that are recovering from soft tissue injuries. I think pretty early in the treatment we chose to start Mo on TRF. Within a couple of months of the treatment started, we started seeing a very positive response to this, and so the optimism started to rise compared to where we had started.
I mean, I think we were all really guarded. I think we took it step by step. I mean, we took a lot of time, and then slowly but surely, we started tack walking, and we did that for a month, and then everybody was really happy, and then we jogged him and he was sound, and then we were really happy. But still, when you bring horses back, any rider will tell you it's very emotionally draining because every day can be different. It's a roller coaster. They can go from completely fine to not fine to back to completely fine. So a little bit of holding our breath every month, but he just kept improving. Every month he got a little better, a little bit stronger.
I think we started 8 months in, 30 days of tack walking, 30 days of trotting 5 minutes, one line on a straight line, and then the other side on a straight line, and then the same, and just building it.
Every step, every morning, I would hold my breath when I picked up the trot to think, oh, is he gonna feel okay? And he has always felt 100%. Even the smallest of trips, I would get very nervous. Horses trip, it's what happens. But every day that I got on him, I started feeling a little bit better, a little bit better.
We had been jumping him over small jumps, and we'd been jumping 4 or 5 jumps once a week. And it was kind of like, all right, he's stayed sound. He's not showing us any changes in the ultrasound. The leg looks fantastic. Time to see if he can hold up. So I think we took him over to WEF and we did some meter 10 classes, 1 or 2, held up with that. The next week we did 120 class, held up with that. And then he did his first 130 class, I believe it was week 8 of WEF. And then since then we've graduated into, and he's done his first 145s at the 2-star.
I knew he was fit enough, I knew his body was ready, but taking that next step, I definitely was holding my breath, but I trust my team around me. When they tell me they believe he can do something, I believe them, and I believed the feeling that I had on the horse that he was ready to go.
Educated vets that we were all agreeing that like this was a concerning diagnosis, and it was a concerning future for the horse, and even life-threatening at times. Going from that initial thought to seeing him jumping Grand Prix again, it is very rewarding and exciting.
I think he feels better than before the injury. I think he feels stronger, he feels more even. I think mentally he feels really, really fresh. So it's almost like he got a new lease on life, and he's ready to go full steam ahead. After seeing the amazing results from Mochito, I put every single one of my FEI horses on TRF. There were so many things that we tried, but the end result is what we have, is a successful horse jumping at Grand Prix level. So the combination of the things that we used, they worked.
When you have a product like TRF where you can add to the other treatments, it is a great adjunctive therapy.
He will never come off of it. And many of my high-level jumpers are also on it now.
The most important thing for Mo's ongoing career and future is, we have a tendon that has had a severe injury, and we are going to be monitoring it closely just for any signs of negative changes. Like with most soft tissues, but especially when you have an injury that has repaired, where there is some scar tissue, there's constant micro damage and remodeling of those injuries. So I do think TRF will provide some degree of building blocks and some anti-inflammatory properties to that area while he's performing as well, not just in the recovery, but more, going forward. And that's also true for a horse that doesn't have an injury, right? I'm sure that we're going to have to add some other therapies as we go, but at the moment we are basically just monitoring it. He has continued getting TRF as a supplement, and we are very happy with how he's progressing.
Mo right now is the oldest horse I have, so he's the main guy, so he'll be campaigning mostly 2 and 3 star level, spring, summer, and into the fall. And who knows, I'll just let him tell me what he wants to do and just enjoy it.